CT scan brain can be learnt in 1 hour, and one should understand the basics of the neuroanatomy for learning CT scan. This slide shows the sketch diagram of the axial view of CT scan of brain. First image is the pencil diagram, which one can practice easily, and once you practice this image, it is very easy to predict, to identify the intracranial structures inside the brain. In the later slides I will explain what are the different parts, but it is just a basic picture which one should practice. And next slide, in the next image, is the colored sketch diagram, and the third one is the real CT scan of a patient. So here you can see these are the ventricles, lateral ventricles. Here I have made like this black, okay, and these are the two cilion fissures, and then when you go in the to identify the deeper structures, you find other structures. This slide gives you a brief idea about the significance of the CT scan. Since the invention of X-ray, which was in 1895 by Röntgen, that's why X-ray is called Röntgenogram, different others new techniques had emerged for the neuroradiology. Initially there was a myelogram. Myelogram, you know that only the dye was injected in the spinal cord, in the subarachnoid space, and then X-rays were taken, that is myelogram. Then angiography in around third decade of the 20th century, around 1927 to 1929. Contrast was injected inside the vessels, that is called angiography. Later bone scan and CT scan, MRI, positron emission tomograph, then SPECT and others neuroradiological investigations had emerged. But all these investigative modalities may not be relevant in any patient, and CT scan of brain is very important neuroradiological investigation, and it has vastly improved the diagnostic accuracy of diseases of the brain. CT scan has been in clinical use since late 70s and 80s, and it has greatly benefited the patients. It is the investigation of choice for head injury patients, and it is useful as an initial investigations in patients with seizure disorder, brain tumors, brain hematoma, identification of hydrocephalus. So it is usually the first neuroradiological investigations which is being done in majority of the patients. CT scan is also known as CAT scan, that is the computed axial tomography. It was, as I told you earlier, it was developed in 1970s, and it is the most important development in the field of neuroradiology after the development of X-rays and angiographies. It is a non-invasive procedure. It uses X-ray. X-ray beam which passes through the tissue produces a picture like X-ray. So the Im- images appear black and white, but in varying shades of gray. So CT scan takes images in the form of slices, that is called tomogram. These are the rounded images of the brain. CT scan uses X-ray as the radiation source. The computer measures the density of the tissue through which X-ray beam passes. CT scan machine uses multiple pencil beams of X-ray which rotate in the gantry and pass through the body on the opposite side dosimeter, which measures the amount of radiation reaching it. Each cubic part of tissue is known as voxel, and in new machines about 512 voxels are used. And each voxel produces a pixel, that is a picture, it is unit of the picture, and it measures the attenuation, and that is called Hounsfield unit. Sir Godfrey Hounsfield from England and Ellen MacLeod Cormack from USA shared the Nobel Prize for invention of CT scan in 1979. This is image of Hounsfield. This slide is very important. It shows what is the value of Hounsfield unit. As I told you earlier that all images of the CT scan appear black and white like in X-rays. Here the all, but there is a in, intermediate gray shades. So all shades of gray for image may be assigned a number, that is called Hounsfield unit. Any Hounsfield value below -15 will appear pure black on CT film, and any Hounsfield value above 155 Hounsfield units will appear pure white. Common Hounsfield values are, so you must remember that the reference point of the image of water on CT scan is 0. Anything which is more white as compared to water on CT scan image, it means white things are labeled as hyper dense and black hypodense, and it is a comparative term. Anything which is more hyperdense, it means less black than water, is CSF. CSF is, although it is black, but it is less black as compared to water. So CSF Hounsfield unit is assigned around 10 to 16. Air is maximum black on CT scan. Air is also inside the brain to make the skull lighter but strong. Those are called air sinuses. Air, or sometimes after the trauma, air may enter, after the surgery, air may enter the brain, that is called pneumocephalus. So if air in the CT scan appears black, it can be -300, -1000. Fat also appears black. It is to be remembered that anything More black than water is the fat and air, and it is around minus 60 to minus 90. Bone is hyperdense, it means bone will appear white as compared to brain tissue. It is white, and the whiteness will depend upon the compactness of the bone. More compact bone will appear more white as compared to brain, and the most white structure is the metal, like the gunshot wounds, they appear white. So this presentation about CT scan is not only about the CT scan, but understanding of CT scan will be better when we talk about neuroanatomy. And neuroanatomy means study of the brain, spinal cord, cranial nerves, spinal nerve, nerve plexuses, dermatomes, muscles, and joints supplied by these nerves. So at the outset, it seems very tough to master neuroanatomy, but it is very interesting and easy to learn. So I will start with the most basic way of learning neuroanatomy is that anatomically the nervous system can be divided into two subdivisions, that is central nervous system and peripheral nervous. Brain anatomy can be described under following headings: cerebrum, cerebellum, and brainstem. Cerebrum consists of two cerebral hemispheres which are connected to each other with commissural fibers. The largest bundle of commissural fibers is the corpus callosum, which connects two cerebral hemispheres, that is right and left cerebral hemisphere. Cerebellum is situated on the posterior aspect of the brain, and it lies below the cerebrum and behind the brain stem. Cerebellum is situated in the posterior cranial fossa, and brain stem comprises of three parts, that is midbrain, pons, and medulla oblongata. Brain constitutes about 2% of the body weight, but it receives around 18% of the cardiac output. It shows the significance of brain as compared to other body parts. It controls all the functions of the body. Human brain is very different from the brain of other creatures because of its immense capacity. So although the cranial capacity of the human beings is less as compared to some other big sized mammals, but the large surface area of the neural tissue contained inside the cranium or skull of human beings is very vast, and it is possible because of the large number of enfoldings, and that is called sulci, and the elevated part is gyri. So the part of the cortical surface of this brain which caves in is called sulcus, and the elevated part of the brain is called sulci, is called gyrus. The Brain is contained inside three coverings. These are called membranes or meninges, which cover the entire brain and spinal cord. The innermost layer is very close to the brain, that is called pia mater. Middle one is the arachnoid mater, and outermost layer is dura mater. Dura mater is the thickest and is also called pachymenings. And the arachnoid and pia are relatively thin as compared to dura, and they are called leptomeninges. The arachnoid matter is a thin, transparent sheath which is separated from the underlying pia by the subarachnoid space, and the subarachnoid space contains a fluid which is called cerebrospinal fluid. So the cerebrospinal fluid is contained between the arachnoid layer and pia mater. Cerebral hemispheres, corpus callosum, brainstem, cerebellum are contained inside a hard bony structure which is known as cranium or skull. It is to protect the soft brain against the hard bony structures. There are certain wide CSF spaces at the base of the brain, and these wide CSF spaces are known as CSF sisters. The weight of brain in an adult is approximately 1.4 kilogram, and it appears as a soft structure. Cerebral cortex on surface can be divided into four lobes, that is frontal lobe, parietal lobe, temporal lobe and occipital lobe. This picture is very simple, but it can give an overview about the central nervous system. And this elongated structure is basically the axis, falls in the axis of the body. And all the CT scan or CAT scan images are basically tomogram, basically cross sections. So you can have an idea about the axis of the brain, and then what are the different components. A very simple picture, but it is very uh, much explains the what are the different structures of the brain. The uppermost are cerebrum, then you see the posteriorly placed, that is a cerebellum, and cerebrum, cerebellum, and then a stem like structure you see, that is called brainstem. And I have made the picture of the subcomponents of the brainstem, that is midbrain, pons and medulla oblongata. And then from the medulla oblongata, that is a continuation of that, the brain which goes inside the spine is called spinal cord. So if somebody asks what are the central nervous system, it is the cerebrum, cerebellum, midbrain and spinal cord. Again, in a very simple manner, but giving the entire overview of the nervous system, this diagram shows the how you approach the study of the neuroanatomy. That is, first there is a central nervous system and peripheral nervous system. Central nervous system I have already defined, it is the brain and spinal cord. And in brain, you know, cerebrum, cerebellum, brainstem. Brainstem components are midbrain, pons and medulla oblongata. and spinal cord is also part of central nervous system. But you know what is the peripheral nervous system? All the extensions of the central nervous system, that from brain the cranial nerves arise, and from the is- spinal cord spinal nerves arise, which supply all the structures of the body. They have the cranial nerves, and this spinal nerves are part of the peripheral nervous. This image is the sketch diagram prepared by me, and it is a very simple image which you won't find anywhere. It is the and I have made a very simple way of mastering the neuroanatomy of the brain. You always start from the basic, that you see the first image which you just practice the shape of the brain, how to draw. You see that is it is egg like, how to draw the cerebrum, and you must have orientation about the anterior and posterior aspect. You see the frontal, at the frontal, on the front it is a frontal lobe, then in the temporal lobe, and you first initially, because once you have the entire, in all the books you will find many images, but it will be very difficult to interpret and very difficult to understand from where one should start. Therefore my idea that you start with practice of making the first image, where you just draw a line diagram of the brain outer one, which can show the frontal and temporal lobes, anterior and posterior. You can have idea about that, and just draw a line where the frontal and temporal lobe are separated. It is called the lateral fissure, and that is called sylvian fissure. Don't try to uh, complicate the things. You first start with this image and you make a sylvian fissure, then go to the next diagram, and now draw a central sulcus, a line or almost perpendicular line which can separate the frontal and parietal lobe. Now you have idea what is the boundaries of the frontal lobe and parietal lobe, that. And then again go to the third image, and there you draw another line, and in a systematic way you can learn the neuroanatomy started from the beginning. And in the same page, once you go through that, now you again make a V-shaped fissure sort of thing in sylvian fissure. There you can understand what are the components of the sylvian fissure, and it is the, although it appears very simple, but it should be practiced. And in this manner, the way you practice this image, you will have confidence about the interpretation of the brain structures in CT scan and in MRI of the brain. And once you have understood making the image of frontal, temporal, parietal and occipital lobe, you see that now you add some lines in frontal lobe. Now you know that it is structures in front of the central sulcus and above the sylvian fissure. It is the frontal lobe. So now we draw two horizontal lines. The moment you draw two horizontal lines, you can understand the superior frontal gyrus, inferior frontal gyrus and middle frontal gyrus. This is very important structure because most of the surgical approaches are taken through the middle frontal gyrus, because it is the non-eloquent area of the brain, and from the right side majority of the surgeries are done through middle frontal gyrus. Now again you see this just draw a line anterior to the central sulcus. Okay, and it is the motor strip. It is the all body parts of the motor areas are represented here. And again you draw a perpendicular line posterior to the central sulcus, which is a part of the parietal lobe. Now it is the sensory strip. All the sensations, they come to this. And again you see a very, in the parietal lobe, a very simple short horizontal line, and which separates superior parietal lobe and inferior parietal lobe. Similarly, as I told you in the frontal lobe, now you focus on the structures below the sylvian fissure, that is the temporal lobe. Draw two horizontal lines, again separating the temporal lobe into three parts, that is superior temporal, middle temporal, and inferior temporal gyrus. Gyrus, as I told you, elevated structures of the part of the brain is called gyrus. And then sulcus is, and a deeper sulcus is known as fissure. You know, it is the sylvian fissure. So now this is image is very important, and it gives, now despite of having so many lines, you can understand structure of the cortex of the brain in a very simple manner. The CT scan, as I told you, it shows you the picture of the brain and also of the bony structures, that is the part of the skull. And in skull, there are the three main foci, yeah, you can say, or three compartments. These are inside the skull. If you cut the skull, you see there is the anterior cranial fossa, middle cranial fossa, or posterior cranial fossa. And how they are divided, there are certain wings of the, certain prominences in the base of the skull, that is called like greater wing of sphenoid, lesser wing of the sphenoid. And there are certain parts like the anterior crinoid process, posterior crinoid process, and there is a petrous bone which separates the middle cranial fossa from the posterior cranial fossa. Therefore you first see the image of the skull, and see the three cranial fossae of the skull, and then see the greater wing and lesser wing of the sphenoid, and sphenoid sinus, and there is a foramen magnum. These are the structures of the skull. Again, this is very simple line diagram, but you can appreciate that if skull is cut vertically and dura or part of the skull is shown, you can see the anterior cranial fossa, where mainly the frontal lobe lies, and there is a middle cranial fossa, and there is a posterior cranial fossa, and there is a dura. Dura, you know, that hard dura, it forms the separates the, that is called tent or tentorium cerebelli. This separates the posterior cranial fossa from the, it is cerebellum from the cerebrum. You just see, it gives an idea about the bone structures, and bones are named as frontal lobe, parietal lobe, occipital lobe. And here you just see the base of the skull, then middle cranial fossa, and one bone you just identify, that is the clivus. This, if you able to identify these structures in the skull, in the brain, so it will be very easy to remember the lateral view or sagittal view of the MRI. This is the superior. If you see the skull from the above, and you find there are certain bones which are connected to each other, fused to each other with the sutures, that is called coronal suture, sagittal suture, lambdoid suture. I have named these three sutures because it is very common, and these are very important also, because once you enter inside the brain after making a craniotomy or opening of the skull, the brain structure is similar. Therefore, one must have idea about the surface anatomy of the skull or surface anatomy of the brain. And coronal suture, it runs, say, in a simple manner, you can say, if you connect the both midpoint between the outer canthus or outer part of the eye to the external acoustic meatus, that is the opening of the ear, that is external acoustic meatus. If you draw a line and you connect from the midpoint of one side to the other side, and it is the coronal suture. It is very important landmark in neurosurgery. Always take care of that. And in coronal suture is also seen as a small indentation in the skull of CT scan of the skull, and therefore it can be identified that whether any anatomical structure is just anterior to the coronal suture or posterior to the coronal suture. Then another landmark is the midline. That is midline. It is called the it connects. It is exactly lies in the midline. We always take care of that. That called sagittal suture, because it is very important structure. And just below this lies a layer of the dura inside the veins. Venous sort of blood runs. That is called the venous superior cestal sinus. Venous sinuses are there, which runs in the midline. Therefore, we always try to avoid the midline, that is the sagittal suture. Therefore, this is very important landmark in CT scan. I have made several line diagrams just to highlight the significance of these diagrams. They appear very simple, but these are very easy and very much required to understand the CT scan. I have shown you see the first, I have drawn first diagram. Uh, it is just to show that if it is cross section, CT scan is a cross section. If cross section is taken from above, it will show only the outermost is the skull. In midline there is a dura which separates both cerebral hemispheres, and you can appreciate the sulci and gyri. But when the cross section is taken from another level of the brain, where you can see the ventricles that are the intracranial structures which contain CSF. Then there are two lateral ventricles, one third ventricle. Here you can see the third ventricle, then frontal horn of the lateral ventricle. That's are parts of the lateral ventricle, like the frontal horn, temporal horn, occipital horn, like these structures. And this image is important to know how the images are taken in CT scan and how the cross sections appear on CT scan. Again, which I had made the image and I explained, I again try to emphasize that lateral or one side view of the face or brain or skull and cross sections can be drawn, and you can understand that. Like the cross section, again it is called axial views or tomogram, and when it taken from the highest level of the skull, it shows only two cerebral hemispheres. So it is very easy. If you see the highest image, you find only two parts, that is the right and left cerebral hemispheres, separated by a thin line that is called dura. And it is usually, when we number the CT scans, we start numbering from the, say, eye level, and when it is usually the last image. So you can see the last image of a CT image. Take CT image in front of you, see the last image, very easy to identify. Only skull is seen and two cerebral hemispheres are seen, and there is a cranial suture in the midline, which I had told you. It is this sagittal suture, and the venous system of which runs between two layers of dura just beneath the sagittal suture is called superior sagittal sinus. See again this image just to emphasize and to simplify the things. This is the highest section of the CT scan. Outermost is skull. In the midline there is a dura, and on either side right and left hemispheres. And another image at the level of cross section at the level of ventricles, showing more structures. And here you can see both lateral ventricles. Now remember one thing, both lateral ventricles are separated to each other by a thin layer of pyometer that is called septum pellucidum. Once we have understood the basic concept of the cerebral hemispheres, now try to learn the deeper structures. Deeper structure, the name suggests, there are certain nuclei, certain compact group of neurons that is called basal ganglia. Basal, as the name suggests, they are deep inside. Basal ganglia, deep seated gray matter nuclei deep inside the brain. The basal ganglia are caudate nucleus, lentiform nucleus. There are two parts of lentiform nucleus, that is globus pallidus and putamen and substantia nigra. It is easy to remember. They are basal ganglia. Basal ganglia are this caudate nucleus, lentiform nucleus and substantia nigra. Third ventricle appears in CT scan as a slit-like structure, black structure, which is a midline compressed between two thalami. Caudate nucleus forms the floor of the frontal horn, and if there is a relatively whitish structure just at the floor of frontal horn, that is a caudate nucleus. Globus pallidus and putamen are situated above the thalamus, and there is a in between this thalamus and basal ganglia there is a internal capsule through which all cortical fibers pass downwards. So the anterior limb of the internal capsule and posterior limb of the internal capsule, anterior limb of the internal capsule lies between caudate nucleus and globus pallidus, and posterior limb of the internal capsule lies between the globus pallidus and thalamus. This is the light diagram just which shows the, you can appreciate the face and you see the structures like ventricle you can see, and you see the just see the fornix here you can see the corpus callosum and fornix. Corpus callosum, these they are rostrum, genu, body, splenium. These are the four parts, and it is the upper roof of the lateral ventricle, and floor of the lateral ventricle is found by fornix, and fornix forms the roof of the third ventricle, and the hypothalamic structures you can see which is of floor of the third ventricle. Here you can see clivus, then sella turcica, then cerebellum, fourth ventricle. Like these are the simple diagram which should usually be practiced repeatedly to appreciate the lateral structures which are seen on MRI or CT scan. as I told you earlier that one should remember the parts of the corpus callosum, that is rostrum, genu, trunk or body, and splenium of the corpus callosum, it which forms roof of the lateral ventricle. The rostrum connects to the anterior commissure. Okay, anterior commissure, and below the anterior commissure there is optic chiasma. A thin pia matter runs and that forms the anterior boundary of the third ventricle, that is called lamina terminalis. And you see the fornix. It is a band of fibers and it is very important structure. It is part of the Pape's circuit, memory and other things. It controls that. It, it is very important structure, but anatomically also it is very important because it forms the roof of the third ventricle. It forms the roof of the third ventricle. This is to describe the basal ganglia structures. It is the caudate nucleus, globus pallidus. Globus pallidus, you see laterally there is a putamen, medially there is a globus pallidus, and then you need the thalamus. External there is a claustrum, so there is an external capsule, and therefore the structure, this structure which runs between this basal ganglia, that is called anterior limb, posterior limb of the internal capsule. I have made several simple diagrams just to show you, to explain the simple structures like corpus callosum and fornix. In this image I have made only the ventricles just to explain parts of the lateral ventricle, third ventricle and fourth ventricle, and how they are formed. Okay, there is a frontal horn of the lateral ventricle, temporal horn of the lateral ventricle, occipital horn of the lateral ventricle. Then part of the third ventricle, you just see the part of the foramen Monro. Foramen Monro connects, there are two foramen Monro which connect the lateral ventricle to the third ventricle, and there is aqueduct of Sylvius which connects the third ventricle to the fourth ventricle. This image is very important to understand the boundaries of the lateral ventricle, structures around the lateral ventricle, fourth ventricle, then pineal gland, parts of the midbrain, tegmentum, tectum, okay, crus cerebri, then the fourth ventricle, and all the parts of the brain stem, that is midbrain, medulla oblongata, and pons, then fornix, then corpus callosum, anterior commissure, posterior commissure, lamina terminalis, optic chiasma, and pineal gland, and other structure, that is a mammillary body on the floor of the third ventricle. These things are not theoretical. These things appear very much in CT scan and more so in MRI. And if one practices this image, you can identify all the structures in sagittal view of the MRI. This image explains different parts of the lateral ventricle and fourth ventricle, and a simple diagram of the transverse section of the midbrain. Anteriormost are two crus cerebri, then tegmentum, which are separated by a black structure. Here I have drawn like a green. It is the substantia nigra. Then on the posterior aspect of the midbrain, there is a small opening that is called aqueduct of Sylvius. Now one should practice this image. This image is the most important part for understanding the CT scan, and all brain structures complicated which normally you want to learn, it can be practiced from this image. Here you see the concept of sulci garai. Then you see the lateral ventricles, the different parts of the lateral ventricles. Then where lies the uh, third ventricle? What is the location of thalamus and how third ventricle appears slit like between two thalami? How the internal capsule will be there between the caudate nucleus and globus pallidus, and posterior limb of the internal capsule between the thalamus and the globus pallidus. Then where is the external capsule? Where is the insula? Insula is deep inside the sylvian fissure. Sylvian fissure. Therefore, where is the interhemispheric fissure? That is between two frontal lobe. Where is the posterior interhemispheric fissure? All things can be appreciated from this line diagram. And this is the most important structure, because in CT scan you find some, like in hypertensive bleed, you find hematoma in the basal ganglia region, so you can understand. In infarct also, in hydrocephalus you see the enlargement of the lateral ventricle in or third ventricle. So to diagnose majority of the diseases, if you understand this image and you practice it regularly, it exactly everything will appear on the CT scan. You make this diagram and then you understand the Hounsfield units, and you see the relative gray scale where something is black, something is white, and you just repeatedly looking at the CT scan of the brain, you can appreciate that brain appears like this. CSF appears black, air appears black, bone appears white, that is hyperdense. You can have an idea about the interpretation of the CT scan. Again, the same picture is made to depict more structures in, in a very simple way. This image is to give an idea about the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa, sphenoid bone, how sphenoid bone separates the anterior cranial fossa from the posterior cranial fossa. Then petrous bone separates the middle cranial fossa from the posterior cranial fossa, and there is a large opening in the posterior cranial fossa that is called foramen magnum, through which the brain, basically medulla oblongata, continues at the spinal cord, which passes through foramen magnum. These are the diagram of the skull, all many foramina, because CT scan is the imaging modality which shows most of the bony structures of the skull. Therefore, although all these details may not be required in each and every case, but it gives an overview of the structures which are seen in the skull. And like the first image shows anterior cranial fossa, middle cranial fossa, posterior cranial fossa, then second image shows part of the anterior cranial fossa, then third image shows structures which are the middle cranial fossa, and fourth image shows the details which are there in the posterior cranial fossa. And sometimes in high resolution CT scan These structures may be visualized and they may be relevant for the diagnosis of certain diseases like CP angle tumor, jugular foramen tumor, like those tumors are a meningioma of the posterior cranial fossa, and therefore one should theoretically know that what are the different parts of the different structures in the middle cranial fossa and posterior cranial fossa. So in this presentation, we are not only focusing only on CT scan, but to understand the basic anatomy, basic physiology of the brain, and how the clinical presentation, by seeing the patient, you can predict what may be there in the CT scan. And similarly, you see the CT scan, you find something, and you see and you predict how the patient may be having the symptoms, because most of the things in brain are very much mathematical. There is a one concept called Broadman areas, because mean almost all the parts, all the functions of the body and all the parts of the body are represented in each cerebral hemisphere, and it is known as Broadman areas. It is very much relevant, and you know that uh, we call the motor strip primary motor cortex, that is the precentral gyrus, and it is given number, that is area 4. There is a just posterior to the central sulcus, that is primary sensory cortex, that is 312 posterior central gyrus, therefore, and these areas are seen in CT scan anatomically. These are the Broadman areas which are given numbers, and this image is good for understanding the psychology, neurology, neuroanatomy, and how, suppose there is a lesion in the inferior frontal gyrus, then what will be seen on CT scan and how the patient will be behaving. Similarly, there is a superior temporal gyrus. Some important broad man areas are represented here in a line diagram. Broadman areas, some other important Broadman areas are primary auditory area, are transverse gyrus of Hessels, that is area 41, 42. Broca's speech area, that is area 44, is situated in the dominant inferior frontal gyrus, usually on the left side inferior frontal gyrus in a right-handed person. Wernicke's speech area, that is area 22, frontal eye field, that is area 8, primary visual cortex, 17, 18, 19 in the occipital lobe. By knowing the arterial supply of the brain, you can also see the effect of certain vascular diseases in CT scan. As you know, the majority of the blood supply to the brain is through the internal carotid artery. There is a, in broadly you can describe the arterial supply of the brain into the anterior circulation and posterior circulation. 85% of the anterior circulation and 15% the posterior circulation. Anterior circulation is contributed by two internal carotid arteries, and posterior circulation is contributed by vertebral arteries. Internal carotid artery is a branch of common carotid artery, and vertebral artery is a branch of subclavian artery. The vertebral artery, that is part of the posterior circulation, supplies the brain stem, that is the midbrain, pons, medulla oblongata, and cerebellum. Remainder part of the brain, that is mainly the cortical cortex, cerebral cortex, that is mainly supplied by the internal carotid artery, which constituted about 85% of the blood supply to the brain. Circle of Willis, a circle of arteries lies at the base of the brain, named after the English neuroanatomist Sir Thomas Willis. It is formed by two anterior cerebral arteries connected with each other over anteriorly through anterior communicating artery. Two posterior communicating arteries are connected to the posterior cerebral arteries, which are the terminal branches of the basilar artery. This image shows the parts of the basilar artery, how the two vertebral arteries they unite together to form the basilar artery, what are the different branches of the basilar artery, and then there are two cerebral arteries which are the terminal branches of the posterior cerebral. This is a very simple but very important diagram where we can see the components of the circle of Willis. There are two anterior cerebral arteries joined by anterior communicating arteries, and how middle cerebral arteries they run laterally in the sylvian fissure but doesn't contribute in the formation of circle of Willis, and then basilar artery which divides terminally into two posterior cerebral arteries which form a part of the circle of Willis, and this the they are these two posterior communicating arteries and they form the circle of Willis, and how the vertebral arteries unite to form the basilar artery. Therefore, it gives a rough idea about the both anterior and posterior circulation. This slide, this line diagram shows the orientation of the uh, anterior circulation, how internal carotid arteries are running and they are entering inside the skull, and you see the posterior circulation is supplied by vertebral artery which runs through the foramen transversorium, that is the opening in the transverse osses of the this cervical vertebrae, from C6 to C1, and this run through that and then it enters to the brain through the foramen magnum and supplies the brain. Vertebral arteries pass through the foramen transversorium, that is an opening in the transverse process of C1 to C6 cervical vertebrae. The transverse process of C7 vertebra has only a rudimentary opening, and of the and it enters the brain through the foramen magnum. This image is very important image which shows the relation of the anatomical structures which are situated at the base of the cerebral hemispheres and in front of the brainstem, how the optic chiasma, optic nerves, the other vessels, some other sensitive structures like the mammillary bodies, pituitary, they are related to each other, and this is for understanding of the pathophysiology of certain diseases also. To understand the CT scan, one should also have some idea about the venous system of the brain. That is, all the veins of the brain drain into the internal jugular vein, which drains into the right atrium of the heart. But the venous drainage of brain is different from other structures of the body. Veins of the brain are described as superficial and deep venous system. This diagram very much explains the formation of the superior ancestral sinus, then inferior septal sinus, inferior sinus, then all superficial cerebral veins of the brain. These are the deep cerebral veins. That is the internal cerebral vein, vessel vein, thalamostrated vein, great cerebral vein. As CT scan shows all the details of the skull, therefore this diagram shows the parts of the skull, that is the coronal suture, sagittal suture, lambdoid suture, and the overall superior view as seen from above. These are the anatomical parts of the bones of the posterior cranial fossa. One can have orientation about the lambdoid suture, sagittal suture, both mastoid bones, and external occipital protuberance. And this image is good to understand the posterior fossa surgical approaches for the brain lesions. If someone understands and has an idea about the axial, coronal, and sagittal section of the brain, it becomes very easy to interpret CT scan and MRI. As I told you earlier, the spinal cord is the continuation of the lower part of brainstem, that is medulla oblongata. Medulla oblongata, when it passes through the foramen magnum, that is the opening in the posterior fossa of the skull. Why CT scan is still very relevant despite of many other neuroradiological investigations. Many patients come to our outpatient department and they demand for MRI. They think that MRI is a better investigation, and because it is costly, and but relevance, like in a fracture, in a bony fracture, the value of X-ray is immense. Similarly, in certain diseases of the brain, the value of CT scan is more than any other investigation. Therefore, it is an investigation of choice in brain trauma patients, because a neurosurgeon which manages a brain injury patient or polytrauma patients or neurotrauma patients, their CT scan is the investigation of choice. Why? Because it is very less time consuming and there is a almost no contraindication of CT scan. In trauma patients, every minute counts, every second counts, and MRI takes lot of time, around 30 minutes. It takes only seconds, a minute. Therefore, CT scan is the investigation choice. Moreover, in a trauma patient, nobody is aware about any presence of metal in the body. There may be gunshot injury, there may be pellets in the body, and therefore we make further damage the brain or spinal cord, or there may be some foreign bodies. Therefore, MRI is not advisable in trauma patients. Moreover, whatever we are able to see in CT scan, that is important for managing the patient, because in brain we see contusions, we see fractures of the skull, we see hematomas, we see foreign bodies, we see pillars, we see bullet, other things, and or CSF, whatever. Acute blood appears white on CT scan of the brain, and it is the most important finding we see in the neurotrauma patient, like extradural hematoma, subdural hematoma, intracerebral hematomas. Therefore, one should go for CT scan. And even if patient has pacemaker or some metallic object, It has no contraindication for CT scan. Therefore, CT scan of brain is the investigation of choice in neurotrauma patient. And in some other patients, like in a patient of spontaneous subarachnoid hemorrhage, their CT scan is the first investigation to be done, which shows the site of the hematoma. Although the distal subtraction angiography is supposed to be the gold standard, but if in any patient with coming with acute headache, sudden onset headache, that is called thunderclap headache, CT scan is the investigation of choice. CT scan utilizes X-ray, so it detects bony injuries like fracture, depressed fracture, and hematoma associated with the fracture. There is a better delineation of acute hematoma, a blood-like extradural hematoma on CT scan because it appears hyperdense as compared to brain that is very much white from a distance. CT scan brain is also an investigation of choice for detecting subarachnoid hemorrhage, that is spontaneous subarachnoid hemorrhage due to rupture of the intracranial aneurysm. This image is just to show you what is CT scan. CT scan is the machine which has a gantry and it utilizes computer screen, and CT scan utilizes X-ray as its imaging source. CT machine consists of a gantry containing X-ray source and detectors, and central to the gantry is the aperture within which patient lies. CT scan machine is inside the CT room. The console of the CT is a computer on which the monitor all cross-section images are seen and analyzed. The computer is separated from the CT room by a glass window. This protects the radiologist from the exposure to the radiation. This is the picture of a CT scan where you can see the gantry with a central opening and a stretcher on which the patient lies, and in the gantry part of the skull or body part it passes through that, and this gantry contains both X-ray sources and detectors. The CT scan machine consists of gantry which has a circular opening. The structure like part of the CT machine moves, and depending upon the requirement of the CT imaging, the body part of the patient comes in the center of the circular opening. For CT scan of the brain, this patient's head is inside the gantry, the circular opening. The gantry is hollow and open on both sides. There is no issue of claustrophobia. CT scan involves very less time as compared to MRI, that is a magnetic resonance imaging, and no sound is produced in this process. So CT scan is less time consuming and more comfortable for the patient as compared to the MRI. In MRI, many patients complain about the claustrophobia. This picture shows gantry and moving table, that is the stretcher part of the CT scan machine. The attenuation, that is reduction in the strength of the signal which passes through of the X-ray beam by brain part is measured by the computer. A pencil beam of X-ray passes through the patient's head and diagrammatically diametrically opposite detector measures the extent of the absorption of the X-ray. So again the voxel, that is the unit of the tissue through which X-ray passes, produces a pixel, that is the picture on the CT on the computer. This picture shows the X-ray tube moving in steps in a gantry. They are an fixed array of detector and is the orientation of the skull or head inside a gantry. How CT scan appears? You place the CT scan image on the view box or see through a light. Through a light, you see the all black and white images on grayscale. You read the name of the center where the CT scan was done. Then you see the name of the patient which may be there, and you will be able to place the CT scan in front of you in a very right manner. And you will see most of the CT scan, they depict R for right, left, and you see the first image. When you see the first image of the skull, you see the first image appears like a very small lateral view of X-ray sort of thing. And that first image on CT scan is the localizer view or scout view. It gives an idea about what part of the body part is being imaged. Imaging of which part of the body is done. It is localizer view. And in the same image, you will see certain horizontal lines. This shows that where the cross sections were taken, and it is usually, there are different lines, usually from outer canthus of eye to the external epidermis. There is a line, and for images, it is usually 1 centimeter cuts are usually taken. It could be 5 millimeter or even less than that. In high resolution CT scan, when you do CT scan of the, say, pituitary, sella turcica, or use the temporal bone, like, then you take high resolution CT scan. But usually it is 1 centimeter cuts or 5 millimeter cuts, and those are being numbered positive 1, 2, 3, 4, 5, and goes from below above. And you now see the next images and see the cross sections and then read that image. So the first image on CT scan is a localizer view or scout view. This is usually the first image of CT scan, and it looks like digital X-ray of the lateral view of skull. This image helps the interpreter to understand which part of the brain is being imaging. See the X-ray skull lateral view, and now see the first image of the CT scan which you normally see in a CT image. It almost similar, but there are certain lines. These lines are usually 1 centimeter cut lines, and if they say 20 images have been taken, 1, 2, 3, 4, 5, 6, it is numbered like this. You see those, and then next images will be, it is a lateral view, but other images, because those are cross sections, they will appear rounded. Okay, that is the different images on CT scan. That's why it is called cross section or axial views or tomogram. A digital radiograph is obtained by maintaining the X-ray tube in a stationary horizontal position. This image indicates the body part of the patient which is being studied. The cross-section levels are marked on this image, and it gives an idea about the level of cross-section and approximate number of images and were taken and distance between each cross-section. Now I will do interpretation of this CT scan for you. Now you see these are the four cross sections of the brain at different levels. In the first image you see, you can appreciate the anterior and posterior. This image has been taken at the level of both eyes. You can see both eyes, you can see the nasal cavity, you see middle cranial fossa and posterior cranial fossa, and the section was a little bit above that level. Okay, you see now, you see this is in the posterior cranial fossa, you see there is a medulla oblongata and two cerebelli are seen, two cerebellum hemispheres are seen. Okay, in the third image you see it is at the level of sylvian fissure. Sylvian fissure at the level of midbrain. There is a midbrain, there is a two cerebral fissure. Then in the last image you see at the level of the lateral ventricle. Both frontal horn of the lateral ventricle is seen, one slit like third ventricle is seen, and this sylvian fissure is seen. Here in the last image you can have an idea about how the brain appears on CT scan, how white it is as compared to the CSF, because you are seeing the lateral ventricle, you can see the CSF, and in the first image you have seen the both eyes, but in the orbital cavity there is a fat, and fat I told you it has a negative Hounsfield unit, it is around minus 90 something. Therefore the in CT scan, as air appears black, which can be seen in the mastoid air cells in the external acoustic meters, and all around the CT scan there is air, which is all background is black, but in the orbit also there is a black, in the nasal cavity also there is a black. In the orbit it is black because there is a fat. Therefore you remember that fat air appear more black as compared to the CSF. CSF is also in the sylvian fissure. CSF is also in the sulci and gyri. CSF is also inside the ventricle. You see the ventricular CSF appears black, and brain is whiter as compared to CSF. And all these structures are assigned some Hounsfield units. For simplicity, I am telling you that read water as a 0, read CSF as 10 or 15 or 16, then read brain around 25. Around 25. Again, I will identify the different structures in this CT image. All structures which are very much white, that is hyperdense, it is the cranium. And in the first image you can see the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. The structure, whitish structure, ridge-like whitish structure, which is separating the middle cranial fossa and posterior cranial fossa, is a petrous bone. It is a petrous bone. Inside the brain, in last image and in the fourth image, you see there is a CSF. There is a frontal horn of the lateral ventricle. CSF inside the lateral ventricle. This is a simple diagram just to show the structures which you theoretically see when you cut the brain in a midline. Again, to explain where the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa, what are the structures which lie in the posterior canal fossa, and you see there I have made the tongue and nose and other things, so you can have an idea about where the cerebellum, midbrain, posterior canal fossa structures, then sella turcica, and how they are oriented, how they are close to your eyes and ears. Most of the images are made in a different ways. Here, to explain, theoretically it is called coronal view. You get it? It is the front, from the front you are seeing the brain. If it is curled in a coronal manner, you see both lateral ventricles, you are able to visualize. Here you have visualized how the anterior antehemispheric fissure is placed, and how the frontal lobe is seen, and how deep is the basal ganglia, how ciliary fissure runs, and within where is the claustrum. Okay, these are the, where is the base, and what are the structures just below the lateral ventricle, or below the third ventricle, below the this lateral ventricles. You can see those structures. It is different orient. One should have a different orientation to interpret the CT scan. Everything is seen, but just to have a 3D view where the this lesion, or this space occupying lesion, or some normal intracranial structures, they lie. Where is the, you see where is the corpus callosum? In this image you can see the commissural fibers, they are running from one side to another side, and I told you the largest group bundle of the commissural fibers is the corpus callosum. And what is the orientation of vessel as come in relation to the corpus callosum? Those things are very much required to interpret any pathology on CT scan or MRI. In brain CT, usually cross sections are taken at a gap of about 1 centimeter, but sometimes 2 to 3 millimeter thin sections are obtained, which is called high resolution CT scan, that is HRCT. HRCT is usually taken from a small lesion like pituitary tumor. In brain CT, the localizer view appears like a normal lateral view of a skull with multiple horizontal lines. The horizontal lines which traverse from external acoustic meters to the outer canthus of the eye, that is midpoint of the lateral wall of the orbit, is usually considered at the reference line, and images below it are labeled as negative, and cross sections above it are labeled as a positive. Computer processes the relative absorption of values for multiple blocks of tissue, that is voxel reconstruction of these areas on a display, that is pixel, provides a CT scan appearance. For routine scanning, slices are 5 to 10 millimeter wide, slices of 1 to 2 millimeter are sometimes required for high resolution CT scan of the orbit or pituitary lesion. Selecting different window levels displayed tissues of different density more clearly, bone window and brain window. If in a, if somebody wants to see whether any there is a fracture in the skull, at that time there is more focus on the only skull structures, skull, cranium, then there is no need to visualize brain in that image. Therefore, if a window is created where the structures having 300 or more horns will be depicted on CT, then there will only the skull will be seen, so you can see clearly the fracture there. Or similarly, if you want to see the brain, you decrease the Hounsfield unit so that only soft tissue are seen more clearly. Therefore, sometimes you will find the bone window, which will show only the bony details on a CT scan, just to show any abnormality of the skull, like bony tumor, osteoma, or fracture of the skull, like those things. Here you see last three rows where you don't find any detail of the brain. It means it is the bone window which shows only bony details, and in the above images you find all details of the brain. You see the brain is seen, ventricles are seen, therefore that is a brain window. CT image of brain in brain window, in which the brain structures are clearly visible, like ventricles and lesions in the parietal region. Here I had shown CT image of a patient in bone window, in which the cranial bone was seen and brain structures are seen. This window is used to see the bony changes in the patient, where is the erosion of the bone or a gap or fracture in any bone, particularly here in the parietal bone. Sometimes certain anatomical structures require contrast imaging, like an intravenous attenuated water soluble contrast medium is administered in specific clinical conditions, like in abscess or assessment of the brain tumor in CT scan. X-ray attenuation coefficients can be calculated for each tissue's small volume, that is voxel, and assigned a CT number scale called the Hounsfield unit. This slide is very important and one should remember it. There may be some variation, but for remembering it, for easy reference, don't go into very minute details. Have an idea, and this is I have created in my own way, like Hounsfield unit -60, -90, just for remembering, and it is good for interpretation of the CT scan. Okay, my purpose is to simplify the things rather than making a reference presentation, a reference document for uh, some literary excellence. It is the in usual practice how you see the CT scan. You remember this slide. Here you see, read water as a zero Hounsfield unit, and remember that water is black. Anything more black than water is minus. Remember fat as -100, air as -1000. It could be 300, 800, whatever something recent. But you remember only two things appear more black as compared to water is fat and air in CT scan. Then what about CSF? CSF is also water-like things. But because CSF contains some other materials, like it contains proteins, so it is relatively more white as compared to CSF and compared to water. Do you find water in CT scan? Yes, sometimes in post-operative patients we put saline, like in operation of the chronic cerebral hematoma. Okay, we put saline, you can find water, or theoretically you should know how the water appears on X-ray. How water appears on X-ray. Therefore, in CT scan, you should also know how water appears on CT scan. That is given a reference point 0. CSF is black as compared to brain. So I remember, you remember 25, 30, here you remember 30 to 40. You have seen the brain parenchyma cerebral cortex on CT scan that has been assigned an Hounsfield unit. You remember that 30 to 40 is the Hounsfield unit of the brain. It can be white matter, it can be gray matter, there may be certain variations, but for memorizing you remember the brain appears as 30 to 40 Hounsfield unit. Then there is acute hematoma, extradural hematoma. Once you remember that acute hematomas appear white on CT scan, you can immediately diagnose extradural hematoma, intracerebral hematomas, subacute subdural hematomas, and hematomas of any kind. Even you can detect very thin subarachnoid hemorrhage on CT scan. Therefore, CT scan is the initial first investigation in a patient who is suspected to have rupture of the spontaneous rupture of the aneurysm leading to the subarachnoid hemorrhage. Okay. Then bone, it appears very white depending upon the compactness of the bone. It can be 1000, and then metal, any gunshot injury, pellets or bullet, that will appear very much white. That is the 3000 plus 3000 plus 4000, and it also appears in the normal patients also. Some people wear some rings and other things that appear white, though you can see a metal, like in the skull. There is some dental filling, some other things. If it is metallic silver or something, it will appear very much white. Structures which appear more white as compared to brain are labeled as hyperdense. So the Hounsfield unit of the normal brain tissue is 30 to 40 Hounsfield units. So any lesion more than 40 Hounsfield unit will be called hyperdense lesion, and it will be relatively more white as compared to appearance of the brain on CT scan. Intracranial lesions which show similar appearance of radiodensity on CT scan as compared to brain are labeled as isodense lesions. The intracranial lesions which appear less white than brain on CT scan are labeled as hypodense. So the hypodense structures will be having less than 30 Hounsfield unit. Brain edema appears hypodense on CT scan. Pneumocephalus appears contains air and appears more black as compared to fat and is hypodense. Similarly, arachnoid cyst, which also contains CSF, appears hypodense, that is black as compared to the brain parenchyma. Some diagram I have produced which shows the lateral view of the face of the skull on level A and B cross section. CT image taken at level A is only the two cerebral hemispheres which are seen. One can start reading the CT scan from this level, which is very simple. Inside the cranium is the cerebral hemispheres. There are two cerebral hemispheres, that is right and left. The two cerebral hemispheres are separated by a falx cerebri in midline. Sometimes there is a physiological calcification of the falx. The cranial suture in the midline is called sagittal suture, and venous sinus which lies inside between two layers of dura, it called the superior sagittal sinus. I have repeated many things several times in this presentation just to highlight the things and just to reiterate again and again so that you can have a very simple view about the CT scan. CT scan of skull at the vertex, that is the highest level of the skull. The Hounsfield unit of the brain is about 40. Hounsfield unit of the skull bone is 1000. Cranial bone is more hyperdense as compared to the brain tissue. Fox is visible in the midline separating the two cerebral hemisphere. The cross section at the level of ciliary fissure shows basal ganglia. Basal ganglia are the deep seated gray matter nuclei deep inside the brain. The basal ganglia are caudate nucleus, lentiform nucleus, that is globus pallidus and putamen, and substantia nigra. The frontal horn of the lateral ventricle is seen, and the head of the cardiac nucleus forms the floor of the lateral ventricle of the lateral frontal horn of the lateral ventricle. The globus pallidus and putamen are situated above the thalamus. Anterior limb of the internal capsule is between cardiac nucleus and globus pallidus. Posterior limb of the internal capsule is between thalamus and globus pallidus. CT image at the cross section at the level of ciliary fissure, third ventricle, thalamus, basal ganglia, posterior to the third ventricle is usually a calcification of the pineal gland is seen. Lateral to the putamen is the external capsule. It is situated between claustrum and putamen. Lateral to the claustrum is the insula which is embedded within this. This is a very simple line diagram showing the orientation of the corpus callosum, largest bundle of the commissural fibers connecting the two cerebral hemispheres. And when in the second image you see, when you have a coronal view, you can see you have both the parts of the anterior hemispheric fissure and posterior hemispheric fissure, and how the corpus callosum is connecting these two. And the last diagram, which is a very simple diagram, you know how to draw central sulcus. Therefore, you can have orientation of the boundaries of the frontal lobe and parietal lobe. Again, there is a temporal lobe. These three lines can clearly show what are the frontal, parietal, occipital, and temporal lobe boundaries. This diagram important, which shows the pons and its relation with the petrous bone, its relation with the cerebellum. And this image is important because here is a cerebellopontine angle, and it is a very common tumor, acoustic sonoma, which lies at this level. This is the just to show you how the brain appears during surgery, and it is one photograph I have taken. It is the intraoperative photograph of the frontal lobe metastasis of the brain. And is another intraoperative upper operative image shows how brain appears of the excision of the lesion, and you can see it is the everything we reach to this level first by interpretation of the CT scan, which helps in localizing of the lesion. This image shows the, you see this, there is swelling in the scalp. Ultimately it came out to be metastasis. This is a line diagram to show how the arachnoid cysts are formed. Arachnoid cysts are basically CSF containing spaces, but they are space occupying lesions. It is only the CSF collection between two layers of the between in the arachnoid matter. There are different locations of the arachnoid cyst. Very common site is the arachnoid cyst in the sylvian fissure. I have focused on arachnoid cyst because it is very common to find such type of lesions in CT scan, and in majority of the time it doesn't require any surgery. It is just an observation, and these are the common locations of the arachnoid cyst. Now I will show you how to interpret this CT scan. This CT scan is of patient with arachnoid cyst. Here you see in the lateral ventricle I have shown how the CSF appears. Now you see the Hounsfield unit of this in this large black area inside the brain, because this intensity Hounsfield unit of this is similar to CSF inside the lateral ventricle, therefore it is a arachnoid cyst. Arachnoid cyst is a benign intracranial developmental cyst which is between two split layers of arachnoid and is usually contains clear colorless CSF. So arachnoid cyst is a cyst containing CSF and it forms due to splitting of arachnoid membrane. These are benign congenital malformations. Arachnoid cysts are commonly seen in sylvian fissure, cerebellopontine angle, supraclavicular area, Vermian area, sellar and suprasellar areas, etc. This may appear at any age from infancy to adolescent to adult. Arachnoid cysts may remain asymptomatic throughout life, only to be diagnosed incidentally by a neuroimaging study. Imaging offenses, remodeling of the bone, and imaging characteristics exactly mimic CSF on CT scan and MRI. Symptoms and signs of the arachnoid cyst depend upon the size and location of the lesion. Neuroradiological features of tubercular meningitis. Tuberculosis is very common, and tubercular meningitis is very common, which affects the meninges and then to the brain. And usually, because there is an inflammation, contrast imaging is being done. The contrast enhanced CT scan of the brain reveals abnormal meningeal enhancement, leptomeningeal enhancement at sylvian fissure, tentorium, obliteration of the basal systems, basal meningeal enhancement, that is called basal exudates, granulomas in the basal meninges, ependymitis, hydrocephalus, calcification, ring enhancements, abscess, and other lesions. Here you can see the hydrocephalus. You see the frontal horns are obtended. It is an enlarged lateral third ventricle is now no longer a slit like it is a globular. Sulci gyrri you don't find, and when you go through the contrast you see there is a basal enhancement and the temporal horns are enlarging. These are the radiological features of the hydrocephalus on CT scan in a tubercular meningitis patient. Hydrocephalus occurs in TBM patients. It can be communicating or obstructive type. In communicating type, which is common secondary to an obstruction of the basal systems by inflammatory exudates, and obstructive type, which is less common, and either secondary to focal parenchymal lesion causing mass effect or due to entrapment of the ventricle. Early changes in obstructive hydrocephalus and ventriculomegaly, blunting of the frontal horn of the lateral ventricle, the temporal horns become visible and size become 2 to 3 millimeter. Third ventricle no longer remains slit-like and becomes globular. Sulci are effaced. Basal cisterns are obliterated. Periventricular hypodensity appear. Hypodensity also occurs in brainstem. In this CT scan, you can see the enlargement of the frontal on the lateral ventricle. You see the globular third ventricle and hypodensity in the brain stem. The common site of ventricular obstruction in hydrocephalus is aqueduct, causing enlargement of the lateral and third ventricle. However, there may be fourth ventricular outlet obstruction. The outlet of the fourth ventricle are foramen lusca and foramen magendi, and obstruction leads to panventriculomegaly, that is the enlargement of both lateral ventricle, third ventricle, and fourth ventricle. Periventricular lucency, a very commonly used term, but you know that in CT scan we don't use word radiolucent or radiopaque. It is normally it is in X-ray. You call something radio opaque or radiolucent. So periventricular lucency, a term sometimes used to describe the hypodensity around the lateral ventricle in patients of hydrocephalus, is basically a misnomer, as the term lucency is used in X-ray. The term should be periventricular hypodensity, which indicates that there is a pressure inside the ventricle and there is transependymal flow of CSF. That is a sign of raised intracranial hydrostatic pressure and raised ICP. Raised ICP, that is raised intracranial pressure, indicates need for prescribing cerebral decongestants like estrazolamide, or necessitates some kind of cerebral diversion procedure like external ventricular drainage or ventriculoperitoneal shunting. In cases of TBM, that is tubercular meningitis, periventricular hypodensity could also be due to spread of the inflammatory process, that is due to vasculitis. In CT scan of a TBM patient, you can also find neuroradiological features of vasculitis. In vasculitis, the adventitial layer of small and medium sized vessels develop changes similar to those of the adjacent tubercular exudates. The intima of the vessels may eventually be affected or eroded by fibrinoid hyaline degeneration. In later stages, the lumen of the vessels may get completely occluded by reactive subendothelial cellular proliferation. Ischemic cerebral infarction resulting from vascular occlusion is a common sequelae of tubercular arteritis. The middle cerebral arteries, lenticular arteries are most commonly affected. Here I have taken image of my own patient where I had done ventriculoperitoneal shunting for the management of tubercular meningitis leading to hydrocephalus. Here you can appreciate the tip of the ventricular end of the shunt inside the lateral ventricle, and now the this ventricle size has diminished. On CT scan, tuberculoma may also appear as a hypodense lesion with out of proportion edema in cerebritis stage. Mature tuberculoma shows either ring or nodular enhancement with perilesional edema. Caseating tuberculoma on CECT shows a rim enhancing lesion with a caseating hypodense lesion. It is also called target sign because of the central nidus. This is the uh, uh, case of a patient where you see the calvarium, that is a cranium of the uh, patient is affected, that is called callarial tuberculosis, and contrast CT shows enhanced CT enhance enhancement at this level along with the bony erosion. This is the post-operative CT scan of the patient where I had operated and removed that part of the granulation tissue and bone. I will discuss the features of the intracranial tubercular subdural empyema which I had reported. A 13-year-old boy had presented with history of seizures, a headache, vomiting, altered sensorium, and weakness of the right upper and lower limbs. He had 3 episodes of generalized tonic-clonic seizures in last 1 month: fever, headache, vomiting, weakness of the right half of the body for 7 days. Examination showed valor with hemiparesis. You can appreciate the value of CT scan in emergency. In emergency, the CT scan was done, which shows on the in the just adjacent to the dura there is a hypodensity and edema of the brain. On one side you see sulci garai are very much visualized, but on the other side there is a there is a there is a hypodensity present along with the obliteration of the sulci and garai. This image shows there is several hypodensities along with the edema on one side. Image shows hypodensity on one side of the cerebral hemispheres. I had I had operated this patient, and you see this opening was made in the skull and this pus is coming out of the brain. This is the post-operative image which shows complete resolution of the disease. Neuroimaging revealed left frontal convexity and anterior hemispheric fissure subdural space collection. CT scan of skull with contrast, left frontal interhemispheric paracystal subdural hypodensity in anterior fox region with perilesional edema and effacement of sulci and garai in the frontal region with peripheral enhancement. Decompressive cranectomy or decompressive hemicranectomy. In this, a wide frontotemporoparital craniotomy is done on one side of the cranium to reduce the intracranial pressure. Commonly done in cases of traumatic brain injury and in middle cerebral artery, that is MCA infarcts. About 10 to 15% of patients with MCA infarct suffer from progressive clinical deterioration due to increased brain swelling, increased intracranial pressure, and subsequent brain herniation. A large space occupying infarct or malignant MCA infarct is associated with edema, which is observed between second and fifth day. It is associated with poor prognosis and fatality rate is about 80%. Surgical intervention, decompressive cranectomy is done to avoid this risk. This CT scan shows a large hypodense lesion involving the temporoparietal region on the right side, showing middle cerebral artery infarct causing midline shift. In this CT scan, you can see that on one side there is a hypodensity. Sulci gyri are not seen. And on the opposite side there is Sylvian fissure, sulci gyri and ventricles are seen. It is because of the large MCA middle cerebral artery territory infarct requiring decompressive cranectomy. Another CT image showing a large hypodensity suggestive of an infarct in the middle cerebral artery causing midline shift is effacement of the Sylvian fissure and sulci and gyri on the one side of the brain. A CT image of a patient of an middle cerebral artery infarct which shows that there is a edema, there is a hypodensity and there is a midline shift in this patient. The lateral ventricle on the affected side is compressed. This CT scan shows that hypodensity of the brain is present on the one side of the brain in the middle cerebral artery territory, suggesting an infarct. And in this case, the surgery was done, and part of the frontotemporal parietal bone was removed, that is called cranectomy, and that part is after and this part, this bone fragment is seen here in the operatives at the operation time. Once this bone is removed to through frontotemporal parietal cranectomy, and when patient improves, when there is a less cerebral edema and reduction of the rest, reduction of the intracranial pressure, and patient survives, then after some time, when at the time of surgery decompressive cranectomy, this bone is removed and placed in the subcutaneous tissue in the abdomen. But when patient improves after some time, say after a month or so, then again this bone is removed from this side and placed over the skull. This is called cranioplasty. A large frontotemporoparital free bone craniotomy of about 12 cm to 15 cm is elevated with a lax duroplasty. The free bone is placed in the subcutaneous fat pocket of the right iliac region of the lower abdomen, infralateral to the umbilicus. When patient improves, the cranioplasty is done with the same preserved bone. This is the CT scan image of the patient with spontaneous intracerebral hematoma. In this CT scan, a large hematoma, that is the hyperdense lesion, is seen one side of the cerebral hemisphere, causing effacement of the lateral ventricle, loss of the sulci and gyri on the one side. CT scan helps in the identification of the intracranial hematomas. Intracranial bleeding may occur either outside dura, that is called extradural, or within the dura, that is the intradural. Intradural hematomas are usually subdural or intracerebral. Extradural hematomas constitute about 27%. Subdural hematomas about 26%. This CT scan shows a large intracerebral hematoma. You can appreciate a large hyperdense, that is a whitish structure inside the brain, suggestive of a large spontaneous intracerebral hematoma, that is a hemorrhagic stroke. Hypertensive hemorrhagic stroke common locations are basal ganglia, thalamus, pons, and cerebellum. Common arteries involved is the lenticulostriate branches of the anterior and middle cerebral arteries, which form Charcot Burcard microaneurysms. Lobar hematomas may involve cerebral lobes, and symptoms depend upon the location of the hematoma and mass effect. Any deep large hematoma can extend into the ventricle, causing intraventricular hemorrhage.